here. I'm with Jim Brassfield with Webster University, Professor of Management and Health Services. So I have a couple of questions, but first I want to ask you, I see you've jotted some things down. What's stuck out to you tonight?
Well, I thought this was a great discussion. I thought the wide range of people brought up all the various issues that are associated with the final implementation of the Affordable Care Act, and particularly how it's going to affect one of the critical key constituencies, which are small businesses, and the complexity of the law itself is a problem, and that was expressed. A couple of the participants said that small businesses are kind of overwhelmed. They don't have a lot of administrative capacity, and they're feeling they're going to be overwhelmed by just all the administrative complexity of trying to meet these provisions. And the law itself is complex. Chris Risker pointed out that this is going to be a hard law to implement because it is complex. And if we look at a recent example, the Medicare Part D that came into effect about 10 years ago, if you remember, when that was first implemented, there were all kinds of computer problems, and people showed up at the pharmacy and they weren't on the list and so on. And I think we would be foolish not to think that this much more complex law isn't going to have similar kinds of problems. And I'm sure we'll see lots of newspaper stories about how the computer systems weren't working and people couldn't get hooked up with insurance, and small businesses were miscategorized and so on. So I think we can expect that there are going to be some rough patches as the law begins to be implemented in 2014. But again, if the Part D is any example, now you don't hear that. That in a year or two they straighten those things out, and I suspect that we're going to find the same thing. That in 2016, people will look at this in a much more positive vein, because the implementation problems will be behind us, and hopefully, when things come up that need to be fixed in terms of the law or in terms of the process, that the federal government and the states will figure out a way to fix it so that it achieves what I think everybody wants to do. I mean, you didn't really hear anybody on the panel that said, we don't think people ought to have health insurance, or we don't think people ought to have the kind of financial protection and income security that comes from having health insurance. And it's the question has been for years now, is how to do it and who pays for it. But I think there's not the, I don't hear anybody saying, oh, small business employees shouldn't have health insurance. It's not something that they should even want to have.
Change is hard, our last guest said. Something we've seen on Twitter and elsewhere getting ready for the show, a concern that small business will become overly reliant on government. The very people who have that independent streak in them, and that's what makes them work, have all of a sudden an extra layer of government in their lives. Do you see that as a factor here?
This is the central debate in healthcare policy now in the last several years, and going forward for the next several years, and that is the role of government. Frank mentioned the British healthcare system that is a purely public system, and we're not going there. We're not going to have that. That's not acceptable. On the other hand, we're not going to go back to 1930, before the start of Blue Cross and before the start of government role, where everybody, you paid the doctor with pulled the money out of your pocket, or if you were poor, you gave them a chicken or something like that. I mean, we're not going to go back to that system either. So, and currently, about half of all money that is spent in the healthcare system is raised through taxes. Medicare, Medicaid, the Veterans Administration, and so on. That's not going to go away. That's not going to change. So, government is going to have a central role, and the debate that continues to go on over the Affordable Care Act and over Medicare and Medicaid is how much of a role should government have. And some segments of the population think the role of government should be more, and that would be an improvement, and others think that we need to lessen. But I think no one believes that suddenly government is going to go away. So the trick is to find the proper balance, and to have government play the right kind of role, but not to overwhelm small businesses, big businesses, or individuals.
Jim Brassfield.